I really appreciate you joining our meet and greet session. Today, we'd like to introduce our providers and have them tell us a little bit about themselves and what they do. We'll go through folks in alphabetical order, and each one will, again, say hi and introduce themselves and share some of their specialty work. We'll monitor the chat throughout the session, so please do chime in with questions and thoughts and hellos. We would love to hear from everybody. Just to let you know that this session is being recorded and it will be available afterwards. We know how hard it is over the lunch hour. Folks are wearing many hats, so we understand folks may join and then have to step away for a minute. No worries, the recording will be provided afterwards. So I'll start off. I'm Eve-Lynn Nelson. So I provided child telebehavioral health now for over 2 decades. Really excited again to see faces that I've worked with and have been fortunate to partner with over many years. I'll say starting out, I think sometimes the telebehavioral health is better than in-person care. I think sometimes it gives great chances for us to connect systems of care together, where there's the child and family, the school liaison who sees the child every day and may have seen them over many years during their school development, and then the specialist. Instead of playing phone tag, we're all on the same page and working together in both assessing and treating the child. My particular service, I especially focus on childhood depression, but see patients with the range of behavioral health concerns. Especially with this program, I tend to supervise graduate students and other trainees who are providing service. So again, I really, I'm so appreciative that the students have a chance to work with the rural school sites and really learn about outreach psychology and hopefully think about it as they're out and about and practicing professionals. So I'm going to pass the baton next. Christy, you'll have to let me know. Has Dr. Barnard had a chance to join us?
I don't believe she's available today, so I think we'll go ahead to Dr. Bellinger.
Super. Dr. Bellinger, please share some of your work with us.
Hi, nice to see everybody. I know most of you, but I'm Skylar Bellinger and I'm a psychologist, and I've been working on the Telehealth Rocks and Telehealth Rocks Schools grants for a while. So I love working with you all. I echo Dr. Nelson's comments about, that being such a benefit to be able to work with the school team at the same time as the family and really wrap around these kids in really great care. I'm a school psychologist by training, so I am very passionate about involving schools in our care and that kind of collaboration. So that's one of my favorite parts about doing telehealth on this grant. So I specialize in developmental disabilities, do a lot of evaluation and autism assessment in person, or like with our health system patients don't do as much on the grant. And mostly with grant patients doing behavior management, behavioral family therapy, and training, it's been really fun to get to test out parent-child interaction therapy over telehealth. And some of you all have helped me do that on this grant before everybody was doing it for COVID. So it's been really neat to kind of watch the evolution of PCIT over telehealth, or iPCIT as it's called now, and how well it really works, and how well it works to have school teams supporting that and families there and doing that service over telehealth. So hoping to do more PCIT for those kiddos that are in that age range from 2 to 7-ish, and a lot of times maybe some of those older kids that have some of those developmental disabilities. So I love to see all kids, but we really specialize in the developmental disability group, since there's not a lot of folks that maybe specialize in those kiddos. So Also seeing some of those older kids with cognitive behavioral, doing some cognitive behavioral therapy, and being able to kind of modify some of those strategies for that developmental disability population. Starting to do a lot more toileting. So I'm going to do more of that on the grant, and I love it. It's really productive. You can really make a big impact with some of those behavioral strategies. Roxy's clapping. So it sounds like there's a big need for that. But it actually is a lot of fun to work on, and you can make a big difference in families' lives. So I'm looking forward to that. And then also, working with kids with special healthcare needs, being part of the cystic fibrosis team and cleft lip cup palate team. So kind of addressing those medical issues as well. So I think that's pretty much me. I don't have much else to share.
Awesome. Well, I think Big Difference really does sum up a lot of your work. I think, we're so fortunate that with your creativity, you've adapted some of the PCIT best practices and made it doable in schools and really seeing good outcome. Let's see, I think next we have Dr. Cain.
And I am not seeing her on the call, so we might move along to Ann Davis, and we'll jump back to Dr. Cain if she can join us later.
Wonderful. Please introduce yourself, Dr. Davis.
Yeah, hi, happy to do that. I don't know. There we go. Hi, my name is Ann Davis. I'm a psychologist at the Med Center, and I primarily work right now in the area of pediatric feeding disorders. So folks who come to the feeding team will see a multidisciplinary team. That'll be myself as a psychologist, and then we have Trina Scholes, who's an occupational therapist, and then we have Ashley, who's our dietitian, and all of us see the patients together at the same time. We focus on children with developmental disabilities or medical issues that have negatively impacted their ability to eat by mouth. One of our specialties is helping children to get off of their tube feedings. We just love to work with families and schools on that. But really, we'll focus on anything related to feeding. We have our clinic on Wednesday mornings, and we do a lot of telemedicine and school-based care, and can incorporate other aspects of sleep and healthy lifestyles as the patient or the family needs. So we look forward to seeing your kiddos. Thanks.
And then Dr. Cain has just joined us, so I'll step back to her side if that's okay.
That sounds great. Thank you, Dr. Davis. Welcome, Dr. Cain.
Oh, thank you. So, sorry to be joining a little bit late here. Okay, so hello to everyone. And yeah, I'm a child psychiatrist, Sharon Cain, at the medical center here in Kansas City. And I actually went to medical school here at KU and did my training in child psychiatry and in psychiatry. And actually, as a medical student here, I met a couple of child psychiatrists that really influenced me and helped me decide that that was the field that I wanted to go into. And I've been very happy with that since then. And I've really kind of developed over time a specialty in medication management and learning more about treating children and adolescents with various disorders. You can see some of them listed there. And these are the disorders we commonly see in our young patients. And I enjoy seeing the patients over televideo or telehealth, and that training in telehealth has certainly come in handy recently with COVID. And we see children and adolescents initially, do a diagnostic evaluation and gather all the information. I work with the fellows mainly in the clinic, and then we make a diagnosis and look at a treatment that we think would be appropriate. And we're usually involved if it looks like a medication may be helpful. And we do follow the patients over time and enjoy working with all of our sites. So, okay. Thank you.
Thanks, Dr. Cain. I know you also have done some national work, really, how do we translate our best telehealth and guidelines, how to help others who are looking to start telehealth. So it's exciting to hear your continued work in telehealth. And I know it also reminds me how much we all collaborate, where oftentimes many on this call may share a patient, and how that's really been a helpful and productive work with the students.
Right, and that is so important. I'm glad you mentioned that, because it is not a good idea to use medication as the sole treatment. It's very important that the children and adolescents be, also be working with someone who's helping their parents understand how to use parent management techniques and be involved in therapy as well. And I've been, as Dr. Nelson said, fortunate enough to work with her and others in helping develop some guidelines that have been used nationally or published nationally to help people know some of the important points about treating children and adolescents over telehealth. So yeah, thank you for bringing that up.
I know our families love working with you, and Dr. Sharp, I don't think she's able to be on today, but just appreciative of her work too.
Yes, thank you.
See, I think next we may have Dr. Heitzman-Powell.
Yep, that's me. So my name is Linda Heitzman-Powell, and I began working in, I've always had an interest in helping underserved people, or people with disabilities, or those that didn't have access to the same level of services that other people had. And I began my work with children with in the foster care system back in the a long time ago, back in the 80s. And it was interesting because here just recently, over the last year, I was able to work with and mentor a medical student who got a Clendenning grant to do a survey for foster parents and pediatricians that were serving the foster care system within the medical community. So we're working to get that published. So it's kind of come full circle. From that early interest in the underserved and that needy population, I decided to pursue my advanced degree and came out here so that I could better advocate for children in need. It was around that time that I started working here at the CCHD in autism, and started to learn at that time about the lack of insurance coverage for autism treatment. I had the good fortune of being a LEND student at the same time, so started advocacy work and began that advocacy for insurance reform throughout from starting about 2004 until we really actually got coverage in 2008 under the initial autism waiver here in Kansas, and then subsequently in 2012 when the insurance mandate went through. So my research interests are in training in evidence-based practices and rural outreach. So from there, I became interested through my training programs. I became more interested in how we can better serve parents, and because back then it was terrible. Families were sending their kids, to live with their grandparents, or the families were splitting up in order to be able to get treatment for their children. Excuse me. So I really became interested in telehealth and how can we better serve families in their local communities without having to cause all this disruption just because they have a kiddo that's diagnosed with ASD or developmental disabilities or something along those lines. And that's actually where I first met Eve-Lynn when we first started working on those parent training programs back in the day. From there, part of that, I received federal funds to be able to develop a parent education curriculum. We call it the OASIS Parent Training Program. So we have sessions where we work with parents and teach them basic behavioral strategies for how to be able to be parents as teachers again with their kids that have disabilities, how to be more effective at being able to parent them. We're training coaches on how to be able to deliver that. We currently have funded research for OASIS dissemination, where we're training other people how to train coaches so that we can get that. We currently have coaches in Nevada and excuse me, Washington and Oregon and Missouri and of course Kansas. We've got a hub in Florida at the University of Florida that is working to be able to provide OASIS. So, you know, it really is kind of growing. I just got contacted by a facility in Arkansas to be able to help use the OASIS parent training there for families, specifically of children with autism. Alice and I'll let her talk more about this, recently got funded for a PBS community wraparound grant to help support kids in rural areas, Eve-Lynn, Alice, and I. And then, of course, I'm working on the Can Do grant related projects with Eve-Lynn and this wonderful, committed professional group of people. So over here, we're called KCART, which stands for the Kansas Center for Autism Research and Training, which is like a center underneath all these, you know, Department of Pediatrics and KU Lawrence campus. It's like a cross-campus initiative. Some of the names that you may hear related to the work that we do over here, of course, Alice. Then we have Vanessa Snyder. We have Cassie Bittner, Tori Binger, Tiffany Ward, Mackenzie Danley, I believe her name is, and we just have a new work study student coming in. Her name's Emily Suntkin. I believe she's a LEND. Both Mackenzie and Emily are from the audiology department. So we have audiology, we have OT over here. I'd love to get some speech people over here at some point, but we're really trying to make sure that, you know, we have a good training experience for anybody that comes over here. I chose pediatrics because that's where my first entry was into the system. And I still have a huge interest in the foster care population on ways that we can improve continuity of care for those kids. And, you know, coming into my professional career as a foster parent, the student that I worked with, the medical student I worked with, she came into that project as a, you know, with her experience as a foster parent, right? So it'd be really nice if we can continue that relationship to be able to address some of the needs of our most vulnerable population, which are the kids with IDD or, you know, any other kind of disability, autism, mood disorder, whatever, who are housed in the foster care system where there's a lack of continuity of care. So really my my focus has always been to address the needs of the underserved, the rural, the needy, and be able to provide supports for them. So that's me.
Thanks, Linda. Very well put. I think you've really innovated with using multiple technologies as well, with both some online curriculum as well as the coaching of parents and families with the video. And I really appreciate what you said about, you know, how do we reach the most vulnerable and extend some of our very best behavioral services. I know when I talk with your team, they're always so excited to have the most challenging behavior, you know, be it aggression or self-injury, just always up for the challenge of how can we help that child and family be successful. So thank you.
Thanks.
And then let's see, I believe next is Dr. Swales.
Hi, everyone. I think I know almost everyone except for Roxy and Ashley, and I've heard your names a lot, so I'm excited to get to actually meet you guys today. I'm a child psychologist who is also a part of the Can Do grant. So I do similar types of therapy and support services to what Dr. Bellinger described. And I see patients for telehealth therapy on Thursdays. So if you have a kid who's scheduled for Thursdays, it's going to be probably one of us, and so you might see me then. I also do have a graduate student who's with me on Thursdays too. His name is Jared Sotos. He has a master's in clinical psychology and is working on his PhD through the University of Missouri, Kansas City. So my areas of focus and specialty are child mental health generally, with an extra focus on early childhood. So part of my role in the grant is as the early childhood clinical director. And so I'm really interested in that early childhood part, as well as autism and developmental disabilities. Like several other people, that's something else that I also focus on. I'm also interested in ADHD as well as trauma. And also the graduate student who's working with me, his area of focus is on ADHD. It's been really fun to collaborate with him, one, because he's really passionate about ADHD, and two, there's not a lot of men who work in the field of child psychology. And it's been really fun because I have a couple of patients right now who would prefer a male therapist. And so that's great because we're able to tag team together and really get that need met between the two of us. Kind of as far as some of my work in PCIT, I've been doing PCIT for 11 years now, and I'm a certified therapist as well as within agency trainer. In addition to some of the clinical work that I'm doing for the Can Do grant, I'm also doing a lot of training activities. I was just hanging out with Alexis earlier this morning, and we were doing a workshop for some of the teachers in her school. So some of the training activities you guys might see me doing as well is we're doing a big initiative to train community providers in PCIT, and we have a cohort going right now of community therapists. And then also doing care workshops. That stands for Child-Adult Relationship Enhancement, because everything is an acronym. And the idea of those workshops is to train any adult who works with kids anywhere in some of the strategies that we use in PCIT. Sometimes we jokingly refer to it as PCIT Light, because we teach the adults those strategies within a 4-hour workshop. So that's something I was working on this morning with Alexis and the Coffeyville School District. As far as why I chose pediatrics, my first job out of undergrad working in psychology was at the VA hospital in Atlanta. And I was doing a research project with adults with schizophrenia, substance abuse, and PTSD. And my job was to do interviewing about their life and also about their trauma experiences. And I loved working with that population because I really enjoyed getting to have that time to get to know each person. But what I found when I was doing that is so many people had these really challenging early life experiences. And what I kept thinking is I really wish that we could intervene sooner. So prevention is really what I'm passionate about, and that's why I'm interested in early childhood, and that's why I'm so passionate about PCIT and other interventions where we help adults learn how to better interact with kids, and either to prevent trauma from happening in the first place, or to be that caring adult who can help that child develop those resilient skills that are going to be helpful for them long term. So I think that's pretty much it about me.
Wonderful, thanks, Dr. Swales. It's really exciting to hear, like you said, taking a step back and linking together with prevention. I think that's the holy grail we're all hoping to really advance and catch children and families early, especially with our Can Do project, the disaster outreach project. That's such an important mindset. So thanks for describing that. Thanks also for mentioning the availability across female and male therapists. I know Dr. Lassen wasn't able to join today, so just to make sure I'm mentioning that he is leading some of our more adolescent young adult therapy, and just really having his perspective, I think, is helpful. He does work more with trauma and post-medical trauma, so some of that expertise has been a real benefit to our team. Let's see, I think next that we have Dr. Zhang.
Hello, and Eve-Lynn, you did a wonderful job pronouncing my last name. We were having some conversation earlier with Alexis group about my last name. And yeah, this is a little bit about myself. So actually my, you know, a lot of people call me Alice, but I have another name, and my first name is a single letter E. And I always tell people that's not an initial for anything, because a lot of times people would come back to say, what does it stand for? Or they just automatically assume is E and adding a period, thinking that it might be some initials. No, that's my full first name, and it's also not pronounced as E. It's pronounced as which is another layer of challenge when pronouncing it. But anyway, that's about my name. So I came here in 2012 as a graduate student. So my previous background when in China is that I was a counseling psychology student. I went to graduate school for counseling psychology as well. And then I came to the University of Kansas, Lawrence campus, and became a doctoral student at the Department of Applied Behavior Analysis department. So after I, joined the department, it was a new field to me, but I soon graduated a great passion on applied behavior analysis, or ABA, if you have heard about that short name. So I did a lot of research related to community participation, community living for people with disabilities. But also I was able to, get a lot of my clinical experience working with the Child Development Center at the KU Lawrence campus, where we serve both preschool, regular school kids, but also early intervention for kids with autism. So I really developed a great passion for working with children with ASD and other developmental disabilities. And that's why I then became a Land Fellow. Dr. Bellinger and Heitzman-Powell and Wills mentioned that as well. I get to work with Telehealth Rocks project and learning more about OASIS parent training project, and all of them involving using telehealth to really bridge the gap and provide services to families who need the most help. So there were times, like for example, once I met a parent, like they bring their whole family here to our clinic here, and they were once OASIS trained, they received OASIS parent training services, and then they haven't been here for like many, like I would say 7 or 8 years, and their child who had ASD is already in middle school, high school, and they are encountering challenges that are different than before, and they don't have any resources or support in their area. And we were trying to like brainstorm where they can go, and we couldn't find any place they can go. So they ended up bringing their whole family, including 4 kids. And then we had another parent training session. So those type of stories, I think that's the stories that keep me really passionate about, and keep me working on the things that I'm working on, no matter whether it's always parent training or all the ECHO sessions or series that we have planned so far, and many of you have participated. And also Dr. Heitzman-Powell mentioned that we recently got a grant to provide more training for school and community for PBIS. So just wanting to reach people who do not have those services available in their area and providing those support. I think that's the thing that keeps a lot of us here, do what we do and try to be doing better every day. For me, like my clinical interest or working with the pediatric population, since my area of expertise is in applied behavior analysis, and I'm really passionate about parent training. I do a lot of parent training. I really like what Dr. Heitzman-Powell said in the past about really putting parents, be the person on the driver's seat, so that they have the skills and knowledge and the resources to help their children, to support their children from very early on, and to, maybe when they go to college and when they live independently, all those type of things. And also, Dr. Bellinger already said she has a great passion for toilet training. Me as well. Yeah, we did some really wonderful, potty training webinar for KDHE, and that's something that I am really passionate about, trying to say, I cannot emphasize how important it is to an individual's life, like in terms of their independence and just dignity and self-esteem, all those type of things. So anyway, so I love, if there are opportunities for Oasis parent training to teach parents more skills, or there are kids with autism or other disabilities in terms of behavioral challenges or potty training, I'm all for it. So yeah, thank you all for your great work.
Thanks, Dr. Zhang. Thanks really for bringing it back to the focus on our patients, students, and families. I think that's what we're all aiming for. So thanks for that. I think, again, it's a really wonderful team. I think we'd love to hear if there's any questions or thoughts. We're a small and mighty group today, so it'd be great to hear from all of you. I know you represent our exciting partner school districts, as well as some wonderful statewide programs with Kansas Kids Map and also with the Lynn Training Program. I think we might start with Robert, maybe sharing a couple words about the newer Can-Do project, because I think we may not have touched upon that as we introduce. So again, feel free to then type into the chat your questions or just unmute. We'd love to hear from you.
Sure, thank you. I really appreciate the opportunity to talk to everyone today. So the Can-Do project is more of an extension of our work with telehealth schools, which many of you have been familiar with over the last few years. And so all of the services, and today we talked a lot about individual clinical services and the variety of individual clinical services we can provide, as well as touching a little bit on child-adult relationship enhancement, which is more a training that we can do in schools and for anyone who interacts with children, and some trainings that we've offered in parent-child interaction therapy, which is more for clinicians. So in April, we were very fortunate to receive a grant from SAMHSA that allowed us to continue the work that we've been doing, as well as add some of these more local community-based training work like CARE and PCIT. In addition, this spring we'll be offering some training in areas that are really focused more on trauma and specifically disaster and post-disaster response. So skills for psychological recovery is a training that we can offer, and we'll be offering really focused on post-disaster, post-trauma training for clinicians in that. And then we'll be offering psychological first aid, which is often confused with psychiatric mental health first aid, excuse me. But it's more focused, psychological first aid is more focused on disasters and response to disasters and traumas. And that's available just like our child-adult relationship enhancement more for those in the community that work with children, because the real goal is to expand our work from a really focus on individual and clinical services, a lot of which we've heard today, to also really look at creating resilient communities. We feel like resilient kids are available in resilient communities. We're very excited about the echoes that we've had, these online training opportunities that I know many of you participated in on behavior this last fall. We have an ongoing echo related to resilience and self-care, and that came about because last August, we asked the schools that we work with, sort of what are the areas of need that you have? What would you like assistance with? And working on behaviors, especially kind of behavior issues really related to COVID and being out of school and many of the other things, online school, and just sort of the response to that trauma, as well as resilience and self-care were two that came up. This spring, though, we're really excited to be doing some work with Dr. Cain and also with the Division for Children and Families on psychotropic medications, some new guidelines that Dr. Cain has led, as well as working on things like medical complexity, which we know a lot of our work in the past is related to behaviors, but medical complexity and behaviors often go hand in hand. In students that have medical complexity, often there's also behavioral components, whether it's looking at things like toileting and feeding or other areas. So we're really excited to begin that work and expand that work. So that grant ends in the end of October of next year. We're really excited to continue our work, and the individual services that we're offering will always be there. I know many of you have struggled alongside us as we've been through this process of trying to help transition scheduling for these services into the department and really begin to treat them more like any other service that would happen in the Department of Pediatrics for telehealth. And our reason for that is really specifically because we know these services are needed, and we don't want to be dependent on grants or other things, because we just believe that telehealth and these provision of services at the local level are the types of that's just how it should be. And that's, both for successful children, helping our partners be successful in the local area, as well as just as a department, that's how we should offer these services so that they're available to those who can't travel. So anyway, really excited. And we can talk a little bit. I think most of you on the call know how to refer for services. And that Sunita Lloyd, who joined us back in July, is really coordinating that as we kind of go through this transition period. I think Sunita's on the call today, and I thought I'd let her introduce herself now if she's able to unmute herself, which I always have problems with myself. It sounds like she may not have been able to join us today, but you can see Christy's brought up the slide that the phone number, 978-809-1044, you can call Sunita about a referral for services or a child. We're really excited because we understand that you may not really know exactly what type of services or where to start with a child. So just if you call this number, we'll kind of go through the process and consult with people in the department that you've heard from today to kind of decide the best way forward and get those services scheduled. You can also email her at the email address below. So, we're really excited to be able to remind everyone of all of the different services that are available, not only the individual services, but also the types of trainings that we think are really beneficial. And, we're really excited about being able to move from working with individual children and their needs to really looking at supporting the school and the community to help raise resilient, successful children, because that's what leads to a healthy community and a healthy state.
Hey, Robert, thanks for that overview. We love to hear from you all. We can't wait to get out and about in the state again as the public health emergency. We get past this point in time, but it's been great to also connect with phone and video. I want to make sure I introduce Christy Gagnon as well. And Christy is really helping get the word out about some of the great work that our sites and our providers are doing, and heading up our communication management. You may especially see Christy's name as you all join with some of the Project Echo and some of the training. So welcome, Christy. We have some great questions already in the chat. It looks like one of the first questions was about seeing older kids with IDD and toileting, and it sounds like Dr. Swales that you shared that we have an availability for the older kids as well.
Yes, as long as it's, kind of that behavior of like child is learning how to do toileting, as opposed to like it's more of a medical issue, and we can help kind of hopefully figure a little bit of that out as we're working with them. I said, send us your potty problems, send them over and we'll get it figured out.
And the other thing is for issues like that may have a behavioral and a medical focus, we can certainly also, we work closely, we have the medical complexity echo coming up. We work closely with Dr. Ryan Smith, who's head of our medical complexity clinic here in Kansas City. We'll be leading that along with Dr. Emily Goodwin, who's with Children's Mercy Health System, and Dr. Dana Bakula, who's a clinical psychologist. So happy to offer that, as well as even, I know, for example, I worked with Roxy, who's on this call, about a child that really, for medical complexity reasons, wasn't going to be able to travel to Kansas City, wasn't going to be available through telehealth to really do what was needed, and partnered with, talked to some people in Wichita, along with our medical complexity clinic, and was able to make a referral to the medical complexity clinic at the Wichita campus for that child to be screened, because we know often for many of these issues that have both behavioral and medical components, you may not know where to start. And often, one of my goals is to really make us a lot easier to access and make sure we get our services where they're needed in the state. So hope you'll hit me with the most complicated, difficult things you have, and we'll be happy to try to sort out how to get the services for any students or children in need that you work with.
Kind of along those lines, I think it's good to say, both in person and via telehealth, there's often no wrong place to start. As we've talked, we hear the complexities that the children and families are facing. So just knowing that, we'll talk through and get a game plan, but often that does then branch out to seeing some other services, which I imagine folks have seen with some of their own students who have received services. It looks like a second question may be around opportunities for training around autism. And it sounds like we have many resources along those lines.
Also, yesterday I was participating in the ECHO from KU Med Wichita with Polly's group with Kansas Kids Map, and that ECHO was a great ongoing learning opportunity for primary care providers related to childhood mental health. And then there was also a PCP in the room who was from Parsons and Labette area. And so I think we were trying to figure out too, are there some ways to help connect him to be able to access some of if he has appropriate referrals, that could be, supported through the Can Do project as well. So it sounds like he could contact Sunita for scheduling, but then I also wasn't sure if there was one of the site coordinators like Ashley that they should be in collaboration with.
We've worked with Dave Lindeman in the past, so I don't know if we could reach out and see if there might be an idea with it being in Parsons in that area. I'm speaking off the top of my head, so again, folks on the call may have other ideas of who might be a good connection in that area.
And certainly, our behavioral telehealth services offered through the Department of Pediatrics are available to anyone in the state through telehealth. Parsons isn't currently a site with the Can Do grant, although we'd love to include them in future grants. But certainly, obviously, they can also reach out to Ashley Hooper's on this call with Community Health Center Southeast Kansas, which has children's behavioral health and has a site in Parsons, as well as referring to us, because we know, especially for some of the more complex needs or specialty type of behavioral health needs, we may be more appropriate, and certainly we can schedule those apart from the Can Do program, just because that's something that our department offers throughout the state.
And then I also just wanted to add that a lot of us are also associated with the LIND grant, which some of you are familiar with. And so we do a lot of collaboration between these two grants, and that's the Leadership in Education and Neurodevelopmental Disabilities. And so our whole mission is to train folks that work with children, providers, community members, educators on autism and other developmental disabilities. And so, gosh, I'm like blowing up. Sorry, guys. So we would be more than happy to kind of set something up through that as well. And we have some kind of prepared presentation. So I guess talking to Robert about what exactly you're looking for, and we can kind of try to find the right match for that.
That's fantastic. I wonder if there's any more kind of nuts and bolts questions around, who may or may not be a fit, or maybe hearing from you if there's challenges or things that we may want to think through as a team. I might ask you all, I think where we're kind of not quite sure is some of the directions in supporting students who may have been impacted by the pandemic with loss or change in their families. It'd be great to hear from you all if there's things at the school and site level that you've seen working, or things that might just gaps you might have seen that it might help us prepare as students are re-entering on-site school. Thanks, Alexis. It sounds like you may need to sign off, so thanks for joining. Well, maybe it's a continued discussion. I know it's been one on our mind. We really appreciate folks joining. Any last minute questions or thoughts from both our site audience and our providers?
And Christy, I don't know if you want to go through the upcoming echoes. Pretty exciting to talk about those. Christy is really taking the lead on our echoes. I'm really excited to have her and her excellent organization and management skills for these great learning opportunities.
Absolutely. So we have the Resilience Echo that is starting. It is the last Tuesday of the month at noon. It starts on the 26th this month. And Eve-Lynn and Stephanie are leading that. Eve-Lynn, I don't know if you want to talk a little bit more about what you all cover.
It's 10 skills of resilience. It's really practical skills from things around self-care, things around hope, just that range of resilience. I want to give a shout out to Roxy. It's so nice. Your smiling faces usually on those sessions, and you've given us some really great ideas of things that you and the school have used. So it just tends to be practical sharing of things that folks are seeing work during stressful times.
Perfect. And then we are starting our new all under one roof caring for children with medical complexity echo series on the 27th at noon, and that is Wednesday. That's actually wrong on the slide, so we'll send that out correctly. But if you scan the QR code on there, you can register for that online. That'll take you to the website. And we have pediatricians from Children's Mercy and from KU Med Center who will be talking about emergency and medical preparedness, medical devices, and just really dealing with all facets of children with medical complexity and how to, better work with schools on coordinating care with that. Those are our upcoming echoes that we've got going on.
Super. Thanks so much for taking time out of your busy day. It's great to hear the work folks are doing. We look forward to continuing throughout the school year. Take care.
Yes, thanks to everyone. Been great.
Bye, thanks everybody.